All right, so the big day has arrived. Let's talk about what to expect on the day of surgery. Now, the joint replacement is only a 1-hour procedure, but the whole joint replacement experience is almost an all-day affair. I guess you could say that the day of surgery actually begins the night before, when you get a phone call from the hospital telling you what time to arrive. You're going to stop eating or drinking anything the night before, starting at midnight. The morning of the surgery, when you wake up, you've already understood what medications you can and cannot take with a sip of water before you head to the hospital. And then you're going to drive to the hospital, you're going to arrive at the front desk, and they're going to kind of instruct you where to go. You're going to get changed into a hospital gown, and then you're going to go into the preoperative holding area where you're going to wait to meet a number of different people. Probably the first person you're going to meet is your preoperative nurse. She's going to start an IV for you. She's going to have you fill out some more paperwork, and she's available to answer any questions you have. Your anesthesiologist is also going to come by to say hello to you. The anesthesiologist is the doctor that's going to keep you comfortable during the surgery. Now, most of my joint replacements will get a spinal anesthesia, and it basically is a shot in your back that numbs you from the belly button down. It sounds scary, but it's actually a very kind of simple procedure. You're oftentimes already a little sedated and relaxed for it. The alternative is for you to get general anesthesia. You're going to also meet the circulating nurse. So while I'm doing surgery, there's a nurse that's in the room assisting with a myriad of different things. And he or she's also going to come by to say hello to you. Then you're going to meet me. I come by about 15 to 20 minutes before the procedure. I say hello. We review any questions that you may still have. I'm going to mark the site of surgery, and then we're going to kind of get you all set up to head back into the operating room. Surgery's about an hour, but just remember, and this is for all the family, it takes us about 30 minutes to do the anesthesia, to get the room set up, to get the patient prepared for the surgery. Then the surgery is about an hour. Then it takes us another 20 minutes to kind of get everything cleaned up, to transfer the patient onto the hospital stretcher and get them into the post-anesthesia recovery room. So after surgery, you go to a recovery room, which is a very close monitored unit where you're going to meet a new nurse, and she's going to monitor you carefully and make sure you're comfortable, you don't have any pain, your blood pressure is good, and you're going to be in the recovery room for about an hour. After that point, you're either going to go to the orthopedic unit where you'll spend the night, or you're going to get ready to head home. And that kind of gives you a good picture of what to expect kind of around the day of surgery.